Are you considering having an aesthetic procedure performed? Confused by all the information out there? Welcome to It's a Young Thing, where Nurse Paula Young arms you with the knowledge on all things cosmetic and aesthetic. And now, Nurse Paula Young.
Hey everyone, it's Nurse Paula. Thanks so much for joining me this week. Does your skin lack luster and shine and vibrancy? I mean, are you looking in the mirror and you're seeing enlarged pores and fine lines and dry skin? You know, your skin has many different layers that turn over every so many days. And there's so many layers, and we're really only going to talk about two main categories, the dermis and the epidermis. And the reason why we're talking about this is, you know, there's a non-invasive treatment that you can do that'll help you get more shine and vibrancy and luster to your skin. It's called microdermabrasion. Now, your dermis, that's the lower layer where all your blood vessels and nerves and collagen and elastin are, and that's what gives strength to your skin. But the epidermis, that's the tough outermost layer of your skin, and it really protects you. And we're going to talk about the outermost layer called the stratum corneum, big word. But the stratum corneum really is a dead layer of skin cells. Your skin works almost like a little elevator. It pushes healthy cells from the bottom up until they finally get to the top. And that's the stratum corneum. And it's mature skin cells that are pretty much dead. They're called keratinocytes. And we constantly shed and replace these cells to reveal the cells from the lower layers of the epidermis. Now, these dead skin cells, they can clog your pores, which results in acne, blackheads, flaky skin, a loss of glow and luster to your skin. And, you know, you really do turn over these cells differently depending on what part of your body. Like your face turns over cells at a different rate than the cells on your back. So we're pretty much safe to say that every 4 weeks, these dead skin cells need to be exfoliated. They turn over. Now, creams and lotions and potions, you know, they can work a little bit to get some of the dead skin cells off, but microdermabrasion, that really does work well to slough off these dead skin cells. But, you know, what's the best type of microdermabrasion for acne or scars or wrinkles? Well, for that, we really need to take a closer look at some of the popular types of microdermabrasion and kind of examine the pros and the cons. So crystal microdermabrasion. Now that one's been around for a long time. This is a small wand that sprays fine crystals all over the face to abrade the skin. It's kind of like sandblasting. And there's an attached vacuum port that sucks up the dense skin cells and used crystals. But, you know, these crystals are often made from a non-toxic aluminum oxide or sometimes an organic sodium bicarbonate substance. And it's great for acne because the crystals have antibacterial properties to them. But spraying of these crystals, they can be hard to control. They get caught in your hair. They can get all over the treatment table. They can irritate your eyes. And believe it or not, they can actually even be inhaled. Now, we use at our medical spa, Young Medical Spa, diamond tip microdermabrasion. And what this is a stainless steel wand that's encrusted on the tip with natural or synthetic diamond chips. And it's particle free. And its attached suction wand comes right into contact with your skin. And what's nice about this, you can get really close to the eyes and mouth, and there's different size heads that you can use, like a little tiny cone for in the little creases of your nose to get the blackheads in there, and real large round ones that you can use on the backs of the arms and the décolleté and on the cheeks and even on back acne. And what's nice about this is the suction is applied directly to the skin. So as it's removing the dead skin cells, it's also stimulating the circulation in your skin. And that is great because what it does is it helps generate new cellular turnover and collagen production. And the best part of diamond tip microdermabrasion, the parts are scrubbable and autoclavable. So they're clean and sterilized each time. So, you know, there are other ones on the market. There's vibrodermabrasion, which is the same kind of thing with like little vibrating paddles that go back and forth. And it doesn't really have any suction to pull anything off your skin. I like diamond tip microdermabrasion the best because you've got everything wrapped together. You're getting the stratum corneum taken off. You're getting the circulation stimulated in your skin. And when you're all done, you got a nice kind of like light pink glow that'll subside within an hour or two. But you're left with really nice, clear, smooth skin, open pores. And now any of your facial products that you use can penetrate the skin and actually get down into the layers where it can do the work it needs to do. So my my tip of the day is if you're looking for a microdermabrasion, make sure you go in, have a consultation, find out what products they use, what types of machine they use, and see if you can actually sit down with the esthetician and talk about the procedure and see which might be the best for you. So that's all I have for this week on microdermabrasion. It's a great non-invasive way to clean up your skin, refresh it, get a nice glow back, and take a couple years off of your face within just minutes. Thanks so much for joining me this week. Make sure you subscribe to my podcast on iTunes and SoundCloud, and you can also get more information on our website at youngmedicalspa.com.
You've been listening to It's a Young Thing with Nurse Paula Young. If we didn't discuss a topic you're interested in today, be sure to subscribe to our podcast on iTunes so when we do, you don't miss it. The cosmetic aesthetic world can be confusing. We're here to arm you with quality, truthful information from our many years of experience. For even more info, youngmedicalspa.com.
This has been a Steve Mittinen social media creation. SteveMittenenSocialMedia.com.
The creators, producers, participants, and distributors of this podcast disclaim any liability in connection with the material expressed herein. This information should not be substituted for individual medical counseling. Information on this podcast is not intended to diagnose or prescribe treatment for any condition. It is intended for educational purposes only, based on the research and experience of Young Medical Spa. Discussion of specific treatments is done only in an office visit directly with the patient. Contact our office to schedule.